Hello everyone, and welcome to the 32nd conference of the Italian Society for Palliative Care here in Riccione. And I'm very happy and excited to have with me Marius Ciurlonis. He's coming from Vilnius, Lithuania. He joined us through a very hard journey, but fortunately he's here with us. Marius, would you like to introduce yourself?
Thank you. Thank you for having me. Marius Ciurlonis, working in National Cancer Center in Vilnius, Lithuania, as a head coordinator of oncology and palliative care. As well, I'm president of Baltic Palliative Care Association and a board member of European Palliative Care Association.
Yeah.
So pleased to be here.
Oh yeah, thank you so much. So the first question I have for you is obviously about leadership. That is the topic we have asked you to talk about. So which qualities make an effective leader in palliative care, in your opinion?
Well, it's a really great question, but it's really hard to answer in a few sentences. But if we are talking generally, what qualities need, I think the person who is willing to make a change. Okay. So the most important is that a person who is working in palliative care field and has a will to make a changes, because it's a long journey. Leadership is a challenging journey, and you need to be persistent and brave. In very many cases, right? And whenever you are talking about the changes, you need to understand that changes in our world, in our society, doesn't come just in a second. Because what we see now in generation shifts in our society, that we are being more and more users. So we are consumers. We want to have a very fast effect. But I think what makes a great leader, that he or she is able to understand how important is the time in decision making. So I think two valuable skills that is needed for a leader in palliative care is that person is willing to make a change, and that person is truly loving people.
Oh, that's wonderful. Great. Okay, so here in Italy we are experiencing this fact that a lot of young professionals are coming towards palliative care, are starting palliative cares. And would you have any suggestion for any of them who think that leadership can be something important for their prospect in life?
Leadership is crucial for every single healthcare worker. It doesn't mean being a manager or being a minister of health, but you can be a great leader in your own small team. And if you start with a small, there is always a great pathway, because when you're working in a small environment, you see the small changes, and very often the small changes are crucial. The majority of small changes could have a huge impact, and then we can move forward to the bigger changes. So I think if we are talking about the growth of future leaders, so there's always should be a great idea to start small, to figure out what is really working and what is not working, to learn about the gaps, to learn about opportunities, to learn about the possibilities, to learn how the system works. So jumping right from the start to a high-ranked position, it's not always a success story, but it's always a success story when you combine your passion with your work, and when you're able to address the needs of the patients, the needs of the family, caregivers, of team. Never forget your team, because the true leader is always standing behind the effectively working team.
Oh, that's so wise. Thank you so much for this contribution. Okay, so here we are. Thank you so much.
Thank you.